you check someone for high, you say dosage of copper? How do you check that?
Great question.
You check hair or you check blood?
So,
because I know they're all going to be asking.
No, I know.
He mentioned that.
It's
How
true.
do you check that?
I check.
You come to Tampa.
Yeah.
Naples.
We do work with people remotely, but yes. Because we can get a blood draw anywhere, and we can get hair testing almost anywhere.
Right.
But we test the blood, and then we test the hair.
Okay.
And this is one of the most interesting things I've found in my practice in the past. And if people want to learn more about this, again, my stillmanwellness.com is where the email list is, and you can sign up. We have webinars on stuff like this.
Right. Stillman Wellness, guys.
Yeah. So what we found when we started to test the blood is that oftentimes the copper would be higher than the zinc level. And when copper gets out of control, I told you guys it creates a lot of mayhem, right?
Right.
It wasn't that the copper was toxic. It wasn't like in the 180s, 190s, 200s where it's actually putting people in the ER, the ICU, and rendering them totally disabled due to mental illness. It was in the 120s, 30s, 40s, 50s, 60s, okay? Then I started to look at it in the hair. In the hair, paradoxically, it was often very low. So you have these high levels in the blood, low levels in the hair. How does that make sense? The body is not harnessing the copper. It's accumulating in the tissues. It's not present in a high enough quantity to kill somebody or make them really sick and send them to the hospital, but it's high enough that it's causing a lot of mayhem, right? Just like, sometimes I'll ask patients, I say, if I could make 3 of your problems go away and they can't be taxes, in-laws, or stepchildren, what would they be in I?
That's good.
Everybody laughs, and the older they are, the more they laugh at that joke, by the way.
For sure.
So, you know how you can have a toxic stepchild, toxic mother-in-law, right? They don't make you sick enough to go to the hospital, but they sure make life unpleasant, don't they? The copper is the same way.
Wow.
And that's why most doctors don't know about this, don't talk about this, don't treat their patients like this. But what we started to see was that when you start to treat people with the right bevy of minerals, vitamins, amino acids, supplements, and dietary change that they need in order to optimize cellular energy production, which includes the LifeWave patches and the GHK, CU pathways, right? They start to then push tons of copper out into the hair. And so what's happening is they're optimizing their total body copper stores, right? Just like maybe finally you get enough money to rent an apartment across town and you put your mother-in-law there, and then she doesn't drive you so crazy, right? So that's what we started to see, and that's how we tested. We tested in the hair, we tested in the blood, and that way we know where people are. And man, when I know someone's copper toxic, I'm always excited because I know I can help them. And the thing is, I don't want people to take that phrase, copper toxicity, and get the idea that copper's bad. It's like saying mother-in-laws are bad. That's not at all fair to mother-in-laws who are wonderful and nice. And people need to realize that. Because it's nothing is either good or bad. It's when you put it in the right context that it can be good or bad, right?
Wow.